So let's begin with the cranial nerve number 7. So we shall be covering the fascial nerve pause, which is the fascial nerve is the cranial nerve number 7. And as you all know, the cranial nerve number 7 has various functions that we shall be covering in the following slides. But the very important aspect that you need to remember is that the fascial nerve is the nerve that makes you smile. So if the nerve is paralyzed, this means that you won't be able to smile, and your face is going to be asymmetry actually. So let's go through the fascial nerve pause. And as you can see, the clinical feature of a patient who is having a fascial nerve pause is paralysis. Normally it's paralysis on one side, though we can also have bilateral paralysis of the fascial nerve if both nerve fibers, because we have the left and right nerve fiber roots. So if both of them are paralyzed, means the entire face is going to be paralyzed. But in this unilateral paralysis, as you can see, the mouth is deviated. The eye is not properly closed. The wrinkles in the upper side is going to be having some issues with this wrinkling stuff. So this is the true clinical feature of fascial nerve pause. And as you are going to be seeing, the patient might come to you with fascial nerve pause and you might think he's having stroke. But not every fascial asymmetry is equivalent to stroke, as we shall be seeing in the subsequent slides. So the introduction of this chapter, we shall first begin with introducing to the history of fascial nerve pause. So Sir Charles Bailey first described the anatomy and function of the fascial nerve in the early 1800s. So because the first man to describe this phenomenon was called Charles Bailey, sometimes fascial nerve pause is called Bailey's pass. So if you hear the word Bailey's pass, then we are referring to the word fascial nerve pause. In the past, it was thought that the cause of fascial nerve pause is unknown. So it was sometimes known as idiopathic fascial nerve pause. So idiopathic means the cause is unknown, as the name suggests. But as we are going to be seeing in the subsequent chapters, that currently the cause of fascial nerve, in certain percentage, the cause of fascial nerve pause is known. So it's no more called idiopathic, unless otherwise the cause is still unknown. So let's begin with the anatomy of the fascial nerve. The fascial nerve has the following functions. First of all, the motor fibers that innervate the fascial muscles. They are nerve fibers that innervate the fascial muscles, like I said. But they have parasympathetic fibers that innervate various glands. For example, the lacrimal glands, the glands that secrete tears, submandibular, sublingual, salivary glands. But you also have afferent fibers that innervate the anterior 2/3. Remember, the anterior 2/3 is innervated by the fascial nerve, while the posterior 1/3. So the tongue is divided into two parts, the anterior 2/3 and the posterior 1/3. The posterior 1/3 is innervated by the glossopharyngeal nerve. But you also have some somatic afferents from the external auditory canal and pinna. So these are some of the functions of the fascial nerve. But in the anatomy, the other issue that we are going to be talking about is the root. As we all know, most of the cranial nerves originate. Their nucleus originate from their nucleus innervate. Their nucleus originate from the pons. So
go ahead.
So let's proceed. The nucleus of the pons is the origin of most cranial nerves. So as the nerve traverses, it traverses through the internal acoustic meatus. As you can see, this opening here is called the internal acoustic meatus. And it is as this area where most pathologies of fascial nerve pause originate. Kama mnavyoweza kuona hapa, hii opening ni very small. Or if it occurs any disorder, hii nerve ikaswell. In whatever reason, for whatever reason, if this nerve swells, it's going to be compressed by this small opening. So the other opening through which the fascial nerves terminates outside is called the Styro Mastoid Foramen. So, but the very important one is the internal acoustic meatus, because it's where we get various pathologies of the fascial nerve pause. So for you to understand the fascial nerve pause, you need to understand where the nerve originates to where it terminates, or where the foramen where it passes through, because through this foramen it's where it is going to be compressed. So this diagram is still explaining, and the very important segment through this cause, or through this route of fascial nerve, is this area which is marked in orange color. It's called the labyrinthine segment. So this labyrinthine segment is the very narrow area of the internal acoustic meatus where the fascial nerve is going to be compressed whenever it swells for whatever reason or whatever cause. The other issue that you need to know is the fascial nerve has various branches. We have about 5 branches as shown in this diagram. We have the temporal branch, zygomatic branch, the buccal branch, the maginomandibular branch, and the cervical branch. Oh, these are the 5 branches of the fascial nerve. As you can all see, they innervate the upper part of the face, the mid part, and the lower part of the face. So let's talk about the causes. What causes this nerve to paralyze? So as I said earlier, that initially it was thought that the cause of fascial nerve pause is not clear to scientists, and it was therefore called idiopathic. But thanks to various researches that the cause of fascial nerve pause is currently known, and it's presumably swelling of the fascial nerve due to an immune or viral disorder. So any viral disorder is going to make this nerve swell, and as it swells, it is going to be compressed. Like we have seen, the foramen through which it goes is a very, very narrow foramen. So if it swells, means it is going to be compressed by the bones of this foramen where it goes through. So the leading cause of fascial nerve pause is the herpes simplex virus infection. It's the most common, but the second common one is the herpes zoster. One can get fascial nerve pause because of these 2 viruses. And the commonest area where the nerve swells and becomes compressed, like we saw in the previous pictures, is the labyrinthine portion. So we also have various disorders like Lyme disease, sarcoidosis. Though very rare, they also cause fascial nerve pause. Now, the pathophysiology of fascial nerve pause. Like we said earlier, that if someone is having fascial nerve pause, normally what occurs is that because the fascial nerve pause innervates the upper and the lower part, a patient who is having fascial nerve pause is going to be paralyzed. He's going to be paralyzed in the upper part, but he's also going to be paralyzed in the lower part. So this is very important because it is going to help you to differentiate stroke, for example. Stroke is the region that occurs in the central nervous system, specifically in the brain. So this is going to help you differentiate between the central nervous disease disorders together with the lower nervous system disorders. Now let's take an example of how the face is innervated. So we have the nerve fibers that originate from the right hand side and from the left hand side. As you can see, this purple color. This purple color originates from both lower and upper. It originates from left and right upper parts, and it desiccates. So the left upper part is going to innervate the contralateral part. This is very important to remember that if the right part is damaged, you are going to paralyze on the left side. So it is very essential to know this. But the other issue that you need to note from this diagram ni kwamba tuna hii green color. Hii green color kama mnavyoona ina originate from the right hand side na inaenda kuinnervate the left hand side of the face. So now assume fascial nerve, kama tulivyosema, the fascial nerve ina originate from the pons. The pons is part around the mid-brain na inakuja kuinnervate the face kupitia zile roots ambazo tumeziongelea. Now assume the fascial nerve pause imetokea. Ikitokea hapa means both this purple neuron is going to be paralyzed together with this call it blue lesion this blue neuron is also going to be paralyzed. So the entire face is going to be paralyzed. This is very important to note in this diagram. So let's compare the contralateral diagram. Now assume you're having stroke. Now we have two types of neurons. We have this nucleus, we have the upper neuron, but we also have the lower motor neuron. So we have three parts of this diagram. We have the upper motor neuron region, the upper motor neuron, but you also have the nucleus and the lower motor neuron. Now let's take an example when you are having a lesion in the upper part of the neuron. For example, if you're having stroke, stroke is going to block this part here, because stroke is the disease that affects the brain part and not the lower part of the brain. So if you have stroke, means you are going to block this part here. And this means what? The nerve fibers that originate from the left side, the left side, yeah, is not going to innervate the parts of the face. But remember, the face, more especially on the upper part, is innervated by roots from left, and is also innervated by the roots from the is innervated by both roots, as you can see, as shown by this purple color. Kwa hiyo a central nervous system lesion haitaweza kuiparalyze ile ya upande wa pili. Kwa hiyo kama mnavyoona, hii neuron itaendelea kufanya kazi kwenye pink color, kwa hiyo itaweza kuinnervate ile upande wa juu wa uso. Therefore, this is trying to explain kwa nini wagonjwa wa stroke wana paralyze sehemu ya chini ya mdomo, lakini sehemu ya juu inakuwa free. And this is in opposite kwa ile case ya fascial nerve pause ambako neuron inakata hapa katikati. Kwa hiyo mwisho wa siku mtu ana paralyze both upper and lower part of the face. Kwa the very important aspect ya kujua ni kwamba sehemu ya juu ya uso inapokea innervation kutoka sehemu mbili, wakati sehemu ya chini ya uso inapokea innervation kutoka upande mmoja wa ubongo. This is very important. So this same diagram is trying to explain what I've been trying to explain, and these explanations are also trying to explain what I'm trying to explain. Now, what are the clinical features of fascial nerve pause? So the very first thing, like we said, the fascial nerve innervates the area around the ear, so one will feel pain behind the ear. The other issue is, the other clinical feature is going to be paralysis, and normally complete paralysis is going to develop usually within 48 up to 72 hours. But the other issue is one may feel numbness or a feeling in the face. And the other issue that you need to know is the fascial nerve enables you to bring to make wrinkles, to make grimace. So if the fascial nerve is paralyzed, you can't even make wrinkles. You can't even puff out the cheeks. If you tell the patient who is having facial nerve paralysis to puff out the cheeks, you won't be able to make wrinkles, won't be able, like we normally do in a cranial nerve examination during central nervous system. So these are the patients who really need thorough CNS examination. But the other issue that is going to be prominent in patients with facial nerve pause is the prominent palpebral fissure, and normally the eye is not going to be able to cross. Kwa hiyo hata ikifika muda wa usiku, mgonjwa mwenye facial nerve pause atasinzia, lakini jicho moja litabaki liko wazi. So this is going to be a very important aspect when we talk about the treatment of this patient, because jicho likibaki limefunguka muda wote, at the end of the day, kama aliweza hata kublink, at the end of the day ni kwamba jicho litakaukiwa yale machozi. Nakumbuka facial nerve ndio inayo innervate zile glands zinazoachia machozi. Kwa hiyo mwisho wa siku mgonjwa jicho litakauka na litaharibika kwa sababu machozi yanahitajika for application of the eye. Well, these are some of the clinical features. Now, the previous diagram I was trying to show you the upper motor neuron and the lower motor neuron pause. The upper motor neuron pause ni kama pale tunapopata stroke. Stroke tumeona ina damage sehemu ile ya juu. Lakini lower motor neuron pause ni hapa tunaongelea facial nerve pause, kwa sababu the lower motor neuron katika hii case ni kwamba inaanzia pale kwenye pons, kwenye nucleus ya pale facial nerve inako originate kwenye pons pale mpaka kuja kwenye uso. Kwa hiyo any lesion ikitokea kuanzia kwenye pons kushuka chini, hiyo tunaita lower motor neuron pause, na kwa mfano mzuri ni facial nerve pause. Kwa hiyo mgonjwa mwenye lower motor neuron pause au kwa mabano unaweza kusema facial nerve pause, hataweza kuwrinkle forehead kama tulivyoona, hataweza kufunga macho, the nasolabial fold atakuwa amepinda mdomo kidogo. Kwa hiyo hii ni kinyume na hapa motor neuron pause ambayo inatokea kwenye stroke na magonjwa mengineyo. Mgonjwa atakuwa anaweza kufumba, wakati wa usiku ataweza kufunga macho kabisa, na pia atakuwa anaweza kukunja uso. Kitu pekee utakachokiona ni kwamba mdomo utakuwa umepinda, full stop, but the upper part of the face is going to be working. Kwa hiyo ndio tofauti kubwa iliyoko kati ya haya magonjwa mengine. Now the clinical evaluation. Mgonjwa akija kwako utamuevaluate vipi? Kwa hiyo tuliona one of the causes of facial nerve pause, tumeona kuna virus, herpes zoster, herpes simplex. Lakini pia tumeona na magonjwa ambayo yako rare kama Lyme disease, sarcoidosis. Kwa sarcoidosis ni ugonjwa wa mapafu, kwa hiyo mgonjwa atahitaji kufanywa chest x-ray au CT of the chest ili kurule out ugonjwa wa sarcoidosis. Lakini pia kwa sababu tumesema huu ugonjwa nerve ina swell, na nerve ikiswell unaweza ukifanya magnetic resonance imaging unaweza ukaona kabisa kwamba there is a problem. But moreover, CT scan na MRI zinaweza zikakusaidia kujua, je, huyu mgonjwa amepooza ana uvimbe kwenye pons au ana uvimbe kwenye nini? This is going to help you kufahamu, kwa sababu kama ni stroke utairule out kwa kutumia CT au MRI. The other issues that we can do ni pamoja na serum glucose, kwa sababu tunajua diabetes also can cause neuropathy. Though diabetes haileti mononeuropathy, kwa sababu hii ni neuron moja ndio imeparalyze the facial nerve. Normally diabetes neuropathy is a polyneuropathy. It damages various nerves and not a single nerve, but it's very very essential kufanya hicho kitu. Kwa hiyo what are the treatment of facial nerve pause? The treatment goal, kitu cha kwanza ni kuiprotect cornea, kwa sababu tumesema facial nerve ndio inayo innervate zile lacrimal glands na ndio itakayohusika kwenye kutoa machozi kwa maneno mengine. Lakini pia tumeona kwenye facial nerve pause the orbicularis oculi haitaweza kuwa inaweza kuifunga jicho, kwa sababu the orbicularis oculi pia iko innervated with the facial nerve. Kwa hiyo jicho litakaa wazi iwe usiku iwe mchana. Kwa hiyo unahitaji kumfunga mgonjwa, kumprotect huyu mgonjwa asije akapata corneal damage. Na normally tutatumia natural tears, tutampa mgonjwa natural tears, zinauzwa kwenye maduka ya dawa. Lakini pia utampa utepe ambao atatumia kufungia jicho, kwa sababu jicho haliwezi kufunga lenyewe, utamwekea patch ambayo itamsaidia kumprotect, more especially kile kipindi akiwa yupo kwenye usingizi. The other issue is the use of corticosteroid. As we know, corticosteroids are strong anti-inflammatory. na kitu kinachoifanya hii nerve iwe paralyzed ni kwa sababu imeswell because of an inflammatory reaction of the herpes simplex virus. Kwa hiyo tunahitaji kutoa dawa kama prednisolone 60 to 80 mg once a day, na inapendeza matibabu haya ukianzisha ndani ya ndani ya masaa 48 for adequate recovery. If you don't do this, if you delay, the recovery ya mgonjwa itakuwa very slow. The other treatment ambayo unaweza ukamfanyia mgonjwa wako ni pamoja na physiotherapy. Unaweza ukawa unamfanyia mgonjwa afanye mazoezi ya kupiga miruzi, yale yanajaribu kuifanya ile fascial nerve iweze kurecover. Dawa ambazo hazina umuhimu wowote ni dawa ambazo ni antiviral kama cyclovir. Regardless the fact kwamba anayeleta ni herpes zoster, anayeleta ni herpes simplex, lakini the use of antiviral medication has been found out kwamba haina any benefit kwa mgonjwa in recovery and in cure. Kwa hiyo that's all that you need to know about the fascial nerve pulse. I don't know if there are any questions. If there are any questions, please just type in the chat room and I'll be there to reply to your questions. Now let's talk about the trigeminal neuralgia. Now trigeminal nerve is the 5th cranial nerve. Now one of the things ambayo wanafunzi huwa wanasahau ni kwamba the trigeminal nerve ina fibers za aina mbili. Fibers za kwanza zinafanya sensation na fibers za pili zinafanya motor part. Kwa hiyo unapotest cranial nerve, kwanza lazima utest sensation kwenye sehemu ya uso, kwa sababu sehemu ya uso hii yote iko innervated, sensory part iko innervated with the cranial nerve number 5. But again, the muscles of mastication, zile muscles zinazokusaidia kufungua mdomo, kufunga mdomo, kutafuna, zinaitwa the muscles of mastication, ziko innervated by the trigeminal nerve. Now let's talk about the trigeminal neuralgia. Now trigeminal neuralgia, mgonjwa wa fascial nerve pulse atakuja kwako akiwa amepooza, lakini mgonjwa mwenye trigeminal neuralgia atakuja kwako akiwa analalamika kama anapata short, maumivu ambayo yanafanana kama short ya umeme kwenye uso wake. This is the typical clinical feature of trigeminal neuralgia. Ni kama short inakuja na kuondoka, haichukui muda mrefu, inakuja na kuondoka, inakuja na kuondoka. It's like an electric shock pain that normally inajidistribute kwenye yale maeneo ambayo trigeminal nerve innervate. Kwa hiyo this is the typical feature of trigeminal nerve, na usiichanganye na hii fascial nerve pulse ambayo tumeimaliza. Kwa hiyo katika anatomy kitu unachohitaji kujua ni kwamba the trigeminal nerve ina branch 3, kuna ophthalmic, kuna maxillary na mandibular, V1, V2 and V3. Lakini pia kitu kingine unachohitaji kujua pia, the trigeminal nerve inatokea kwenye pons. The trigeminal nerve inatokea kwenye pons, lakini yenyewe itapita kwenye Meckel cave au sometimes inaitwa the trigeminal nerve cave. Kwa hiyo hapa ndiko sehemu itakakopita, na katika maeneo haya ndiko ambako huwa inakuwa compressed, mgonjwa anaanza kupata hayo maumivu ambayo yanafanana na short ya umeme. Now let's see pons. Kama mnavyoona pons ni hii sehemu hii, na unaweza ukaona hizi ni trigeminal nerves ndio zinako originate, iko left iko na right. Kwa hiyo branch zake kama mnavyoona, ophthalmic ita innervate hii sehemu ya juu, maxillary ita innervate hii sehemu ya katikati, mandibular ita innervate hii sehemu ya chini. Kwa hiyo hii ni katika sensory part, lakini katika motor kuna motor branches ambazo zinaenda kuinnervate zile muscles of mastication. Sehemu kubwa ya muhimu ya kufahamu, ubongo, fuvu la mwanadamu lina mashimo matatu. Kuna moja inaitwa the anterior, kuna moja inaitwa the anterior cranial fossa, kuna the middle cranial fossa and the hind cranial fossa. Kwa hiyo sehemu kubwa ambayo ni muhimu kuijua ni hii the middle cranial fossa au the Meckel cave, ambako ndiko the trigeminal nerve inakopita kutoka nje ya fuvu. Kwa hiyo hii sehemu, mfano ubongo wakati ukiwepo hapa, ukawa au tuseme ule zinaitwa the temporal lobes za ubongo zimepata stroke au zimepata shida tu yoyote, zikacompress hii trigeminal nerve katika Meckel's cave, basi mgonjwa atapata trigeminal neuralgia. Au blood vessel hii ikavimba au ikableed ikacompress hii trigeminal nerve, mgonjwa atapresent with the trigeminal nerve neuralgia. Kwa hiyo the epidemiology, kitu kikubwa cha kufahamu ni kwamba the trigeminal neuralgia is very common in women, kushinda kwa wanaume, na the reason behind ni kwa sababu wanawake is found out kwamba wanawake wanaishi maisha marefu ukilinganisha na wanaume. Wanaume tunajiinvolve kwenye risky behavior nyingi, kunywa pombe, kuvuta sigara, kufanyaje, kwa hiyo tunakufa mapema. Kwa hiyo it's found out kwamba the incidence imeonekana ni kubwa kwa wanawake kwa sababu wanaweza wakaishi kwa muda mrefu. Lakini kitu kingine cha kujua ni kwamba huu ugonjwa unatokea kwa watu ambao ni wazima, miaka ya 50 huko. Sasa wanaume wengi hatufiki huko. Kwa hiyo wanawake wengi ndio wanafika kwenye 50s, kwa unakuta huu ugonjwa uko dominant kwa wanawake. Tutakuja kusoma types of headache. Kuna headache moja inaitwa migraine headache na ni risk factor moja hapa ya kupata trigeminal neuralgia, lakini hypertension pia inafikirika kwamba inaweza ikawa ni risk factor ya kuleta trigeminal neuralgia. Now the pathogenesis. The pathogenesis of trigeminal neuralgia inafanana na pathogenesis ya fascial nerve palsy, kwa sababu zote ugonjwa unatokea baada ya compression ya nerve kupitia yale maeneo ambako inapita. Na vitu mbalimbali vinaweza vika compress nerve, specifically the trigeminal nerve, lakini kitu kinachoongoza ku compress the trigeminal nerve ni the vascular bundles, the loop of an artery or a vein, kama tutakapokuja kuona mbele. Hivi ndivyo vinavyoongoza kuleta compression. Na nerve hii kisha kuwa compressed pale kwenye Meckel's cave au kwenye middle cranial fossa hapa, ikiwa compressed inakuwa demyelinated. Unajua nerve yoyote ina myelin sheath. Ile myelin sheath ndio inayosaidia katika nerve conduction. Kwa hiyo ile myelin sheath ikiondoka, hata kuna abnormal conduction of the nerve impulse. Kwa hiyo understand about the physiology and pathogenesis. Lakini kuna vitu vingine ukiachana na blood vessel ambazo tumeona zina contribute 80 to 90%. Inaweza originate from a vascular origin, ndio inaweza ikacompress. Lakini tunazo other benign tumors of the brain au malignant ones. Kuna vitu kama vestibular schwannoma au the acoustic neuroma. Nafikiri mlivyokuwa mnasoma hii ya nose and throat kwenye surgical specialty, mtakuwa mmekutana na hii vestibular schwannoma. Sote tunaijua the vestibular nerve, na mnavyojua ile nerve pia ina schwann, kwa hiyo inaweza ikapata chuma ambayo inaitwa vestibular schwannoma, na normally inapita yale maeneo ambako trigeminal nerve inapita, kwa hiyo inaicompress. Unaweza ukawa na meningioma, the meninges zile zinaweza zikaotesha uvimbe ambao unaweza ukacompress. Cyst mbalimbali za kwenye ubongo nazo zinaweza zikacompress. The aneurysm is abnormal dilatation of the blood vessel. Kwenye aneurysm blood vessel inakuwa imedilate, kwa hiyo ikidilate inaenda ina compress. Lakini tunayo magonjwa mengine mbalimbali ukiachana na haya, kama ugonjwa kama multiple sclerosis. Kumbuka haya magonjwa yanaleta nerve compression. Nerve compression ndio inayopelekea demyelination, na mwisho wa siku mgonjwa anapata trigeminal neuralgia symptoms. Lakini kuna magonjwa ambayo bila hata kucompress kama multiple sclerosis, ni ugonjwa ambao unaweza ukaondoa ile myelin sheath kwenye nerve, kwa hiyo ukamfanya mgonjwa awe na manifest kama mgonjwa mwenye trigeminal nerve. Kwa hiyo na yenyewe inakuwa considered kama the cause of trigeminal neuralgia. Kwa hiyo kama tulivyosema, what are the clinical features of this trigeminal neuralgia? Kama tulivyosema, ni maumivu ambayo yako upande mmoja. Kwanza lazima ufahamu, si unilateral pain. Maumivu yanakuwa